Hello, my name is Jay Shore. I am the managing partner of Shore Solutions, a medical practice marketing consulting firm, along with our co-moderator, Mara Shore, who is a vice president and partner of business development. We're here today with Dr. Steve Weiner, a facial plastic surgeon out of Santa Rosa Beach, Florida. We're here to ask Dr. Weiner some little questions about hands. One of the questions I want to ask you, Dr. Weiner, very important, is how do hands show age?
Well, just like the cheeks, they lose fat and they lose muscle mass. And also the skin is damaged from the sun and you lose collagen and elastin. So all those factors factor into aging hands. And what ends up happening is you see the tendons and the vessels become more apparent and the skin loses its elasticity.
When we see that, we notice that it's almost like a tree. As you age, the tree gets a little bit aged and the hands start to show the age. Let me ask you a question. What happens that actually creates that, and how do we fix that?
Well, aging is inevitable, and the sun also causes the sun damage, which gives you spots and pigmentation and so forth. And the muscles start to atrophy a little bit. So what we can do is we can add volume to the hands with fillers. And recently, Restylane Lift was approved for use in the hands to add volume.
And can you tell me a little bit more about when you're doing this in your practice, what have your patients noticed and what kind of results can they expect as far as actual results when you do this procedure?
So the studies show that over 90% had improvement in the way the hands looked, the way the skin looked, and decrease in the visibility of the vessels and the tendons. And that lasted for 6 months or longer.
Okay.
The procedure is probably a 5 to 10 minute procedure with very little downtime. What you can expect is some had a little bit of bruising and some had some swelling, but all subsided within a few days.
So who would be the target market? What is the ideal patient for this?
Well, you start seeing aging in the hands in the 40s and 50s.
Okay.
And so that's when I recommend it. It's better to remember, the hands always show your age. You can do all this stuff to your face, but if you don't do your hands, it's a dead giveaway.
Yes, my grandmother always told me growing up, make sure you wear gloves when you do dishes and make sure you use hand cream at night.
Exactly.
So absolutely, absolutely.
So when a patient comes in, let me ask you, because you treat patients of all different forms and maladies and genders and things like that. When a patient first comes in, how do you approach that if they haven't approached you? Most of the time a patient will come into you and ask you about a specific problem. When you actually see a patient for something else other than the hands, how do you approach that with a patient to tell them that you actually can help them with another form of aesthetic cosmetic medicine?
Well, you kind of say, hey, look, don't just focus on the face, because you know, the neck and the hands and the chest, it's sort of a package deal. You need to do everything. And I'm not just saying that the filler is the only thing you need to do the hands, hand creams, but also even lasers to improve the spots, chemical peels sometimes. So what you do is you tell them, look at, what's your main focus? And that's where we'll address it. But let's do a treatment plan for in the future. Let's include the hands as part of that.
And lastly, could you speak a little bit to the idea of Restylane Lift, knowing that it just recently got its FDA approval, and how you have used this now and how you're going to use it in the future with your patients?
So Restylane Lift is the first hyaluronic acid filler to be approved for use in the hands. And Restylane Lift has a long safety record, and it's safe in the hands as well. The thing about Restylane Lift is also that it's reversibility, which other fillers do not have, and hyaluronic acid fillers do. And it also improves the quality of the skin. That was noted in over 90% of the patients. So typically a patient is going to need anywhere from 1 to 2 syringes per hand, and it's going to give them approximately 6 months duration or longer.
Can you speak for just a moment about how you're spreading the word to your patients through your marketing efforts and how you're getting the word out through your marketing channels about this being an option for your patients.
Well, we just recently did a Instagram post, and because Restylane came in with a big box, and there's little goodies associated with it for our first few patients,
Sure.
which includes some hand cream and some nail polish.
Okay.
That's actually designed specifically for Restylane Lift for Galderma.
Do you know what color the nail polish is? I'm going to say you probably don't.
No,
right?
I haven't
Right.
tried it myself.
Oh, well, we'll give you a pass then. We'll give you a pass. But it's a great way to incorporate that particular procedure into an overall marketing campaign and to really
Yes.
boost the word out and to get the word out there.
Yeah, that's what we're trying to do, because not everyone knows that there's things that you can do for
Correct.
hands. And it's so easy. And you might not think this, but it's a very comfortable procedure, and there's really no pain afterwards.
Right.
So I'd like to use cannulas for that. The FDA approval is to use needles,
Okay.
but that's preference to the physician.
Right. Right.
But it's 3-4 minutes per side.
That's fantastic.
Yeah.
Fantastic.
And knowing that this is a brand new procedure that's been FDA approved, how would you incorporate this procedure into either packages or in combination with other procedures that you do?
Well, I would probably, if I want to do the overall package to the hands, I would incorporate maybe lasers as well, because the sunspots are also an aging phenomenon.
For like a hyperpigmentation, dyschromia.
Yes, solar lentigines and so
Right.
forth. Incorporating the filler, volumize, and improve the skin as well
That's great.
with the lasers.
Once again, Dr. Steve Weiner from Santa Rosa Beach, California. Thank you. We lecture with you all the time. It's a pleasure
Yeah,
to see
great
you
to
again.
see you.
My pleasure.
Thank you so much. Always great to have a fellow Floridian here.
Oh, thank you.